Hello and welcome new DHH parents. I know we're entering a new educational journey for you and your child. Your child is now preparing for preschool, which can be very exciting and overwhelming. We're going to discuss a few topics though that you'll need to know going into this new situation, and I hope this video helps you better understand these topics and gives you a few resources in each of them. Some of the things we're going to discuss are how the ear works, hearing tests, types of hearing loss, hearing devices, and educational placement.
Let us first take a look at how the ear works in order to better understand how it is that we hear sound. The outer ear catches sound waves that travel through the ear canal. The sound then reaches the eardrum, causing it to vibrate, which in turn vibrates three tiny bones called ossicles, or hearing bones. The malleus vibrates the incus, which vibrates the stapes. The hearing bones send the vibrations to the cochlea, which contains tiny hair cells. The vibrations move the hair cells, creating an electrical signal that travels through the auditory nerve to the brain. The brain then interprets the messages as sounds that we recognize and understand.
Now that we know what the ear looks like, let's see how we assess it. There are two types of tests that may be used to understand what your child's hearing looks like. First of all is visual reinforcement audiometry, VRA, and conditioned play audiometry, CPA. First, let's look at VRA. This test uses visuals like stuffed animals or images on a screen to encourage your child to pay attention to what they're hearing. This test is often done in a smaller soundproof room that's called a sound booth. This room may seem a little scary to your child, so encouragement and support play a huge role. Now let's look at CPA. This test utilizes games such as dropping a block into a bucket or placing a ring on a stick when they hear that sound. The sound is transmitted through earphones. These earphones look very similar to the ones you use at home. There are two styles used: headphones that go over the ears and earphones that get inserted into your ear canal. They may also use a bone conductor that gets placed right on the bone bump behind your ear. All this equipment may feel a little uncomfortable, but it doesn't really hurt. Your role during these tests is support, though. This whole process can be very overwhelming for you and your child. And remembering that you are there and reminding them of that is a key part of this process. And remember that audiologists are highly trained in this area, and allowing them to lead the situation is very important. Now let's see how these tests look on paper.
It is important you become familiar with your child's results from hearing tests that are displayed on audiograms, as well as the common types and degrees of hearing loss in children. This is an audiogram, which shows you what your child can hear at different frequencies and intensities or loudness. You can also see the degrees of hearing loss in which your child's hearing may result in, ranging from normal hearing to a profound hearing loss. Additionally, there are three common types of hearing loss your child may have. These are examples of what each hearing loss audiogram may look like. The first is conductive hearing loss, which means that something is preventing sound from traveling from the outer ear through to the cochlea in the inner ear. The second is sensory neural hearing loss, which means that there is damage to the cochlea or the hair cells inside the cochlea. And the third is a mixed hearing loss, which is when there's a component of a sensory neural hearing loss along with a component of a conductive hearing loss.
Now that you have a better understanding of your child's audiogram, I would like to introduce you to some of the assistive technology that is available. The most widely used amplification is the hearing aid. Although there are many different styles, children typically use this style, in which the device is placed on top of the ear, with the electronic sending sound into the ear mold that sits inside. Amplification is also used the FM system that you'll see in your child's classroom. FM, or frequency modulation, is a wireless device used to transmit sound through a speaker. This speaker is often directly connected to your child's hearing aid. These systems are often worn by the teacher and are great for amplifying sound over distance and noisy environments, perfect for a classroom. Other technology is the cochlear implant. The cochlear implant is a small device used for children that have a severe or profound loss. These devices use microphones that sit on the outside of the ear, similar to a hearing aid, and transmit the sound to a stimulator that has been implanted underneath the skin attached to the ear, the bone that's behind the ear. These implants are commonly used to bypass portions of the ear that have been damaged or to directly stimulate the auditory nerve. There are many devices available for you and your child. It is important to talk to your audiologist and determine which of these technology is going to best benefit your child with their specific type and degree of loss. Just like with assistive technology, educational placement comes with many different options. For a preschool-age child, there are 3 different educational approaches: the auditory oral approach, the bicultural bilingual approach, and the total communication approach. Each of these use a different mode of communicating with your DHH child. The auditory oral approach. This approach focuses on developing skills such as listening and speaking. It does not use American Sign Language, but its goal is to include children into mainstream classes. The bicultural bilingual approach. This approach uses both English and American Sign. Children are taught to read and write in English, but are expected to use ASL when communicating in the classroom. This method not only introduces children to the language, but the culture of the deaf community. These programs are commonly found in residential schools and in special day classes. The total communication approach. The TC approach is designed to include both modes of communicating. A true TC classroom would not only promote listening and spoken English, but it would also teach and use ASL. Each of these approaches are valid, and each should be considered based on the needs and abilities of your child. Each method is designed specifically for children with different types and degrees of loss. Prior to placing your child, it is important to not only meet with your audiologists and your therapists, but to communicate with the administrators and educators of each of these programs.
I know that was a lot of information, but I hope it helped you better understand these vital topics. This stage in your child's life comes with many options and decisions. It's important to remember that access to language is the primary goal. How you decide to achieve that is completely up to you. You know your child better than anyone else, and you are their best advocate. It is important to work alongside teachers and audiologists to best meet your child's needs and relay those needs to that team. They're also there for your support. You have teachers, audiologists, and other parents at your side for any help you may need. Feel free to utilize that support team in every way you can.